Monday Morning House Calls, sponsored by UK Healthcare.
Welcome back to Mountain News This Morning. We're being joined today by Dr. James Shoptaw with the UK Gill Heart Institute. Thanks for joining us.
Thank you for having me.
And today we're talking about atrial fibrillation. Tell us about A-Fib.
Atrial fibrillation is a condition in which the top part of the heart does not contract. As you get older, the top part of the heart will increase in size. And a simple way to put it is the wiring in the heart gets stretched, basically. And so the top part of the heart will quiver, and then the bottom part of the heart, or the ventricular chamber, the pumping chamber, will pump. And the reason this is a problem is because as you have a decrease in cardiac output, you need the top part of the heart to pump or push the blood into the pumping chamber, and you can lose about 20% of your cardiac output if you don't have that situation. That's one reason that it's important. A second reason would be that as the top part of the heart is quivering and not pumping, there would be stagnation of the blood, and potentially clots can build up in the top part of the heart, which if the heart later contracts normally, those clots can go places like the head to cause a stroke or a blocked artery in the brain, or it can go to a peripheral artery in the arm or the leg or the intestines and cause a blockage.
Okay. And of course, blockage is not a good thing. Is that the kind of thing that can lead to a heart attack?
Well, it would be more likely an embolic event to a peripheral artery, either in the brain or the arm or leg or intestines, causing a blockage or absence of flow in an area that would suffer from that.
Okay. That being said, how do you know that you might have A-Fib? What kind of symptoms might people have?
A lot of people kind of present with near syncopal episodes because a lot of times if the top part's quivering, the bottom part of the heart will increase the rate, say the 130, 140, 150, and it may not have enough time to fill up to adequately pump, and therefore they would feel like they were going to pass out because their blood pressure would drop potentially.
And if you have this, what kind of therapies, what kind of treatments are available for people with this?
We'd like to restore a sinus rhythm. So sometimes it could be something simple as, say, Dr. Yalamanchi's group could, or Dr. Bakari could perform a cardioversion where they simply apply electric current to the heart to shock the heart and place it back into a sinus rhythm where the top part squeezes and the bottom part squeezes. There's other medicines that can help us to reestablish a sinus rhythm, and then there are also some either percutaneous or surgical interventions where you can restore the atrial contraction or the sinus rhythm.
And of course, getting to this problem before it happens, how do you prevent A-Fib?
Well, I mean, there's some things that would make you more predisposed to atrial fibrillation. Caffeine intake, hypoxia, chronic lung disease, these kind of things.
Of course, a lot of coffee drinkers in the morning. I mean, any particular caffeine intake that's, I wouldn't say optimal necessarily, but that you need to know that you need to cut back?
I mean, I would just say if you're at risk or you're having issues with palpitations and with fast heartbeat per se, I would just try to stay away from caffeine.
All right. Thanks for joining us. Mountain News This Morning continues in just a moment.